If you're new to Medicare, you probably have a lot of questions about which coverage is right for you. To help with that, I've got 3 important questions you should be asking yourself when you're new to Medicare. Stay tuned. Hi, I'm Cullen Teska, an advisor here at Strive Medicare, where our focus is making Medicare simple. Before we begin, go ahead and like and subscribe. So you may be new to Medicare and trying to pick a plan. You see all the advertisements, all the other plans that are being promoted and suggested and that your friends are telling you to sign up for. And so you need to make sure and pick the right plan when you are first new to Medicare. And so I've got 3 simple questions to ask yourself, which will help direct you to the right question instead of picking the plan that's just promoted by John Elway, which could be a great plan, typically Medicare Advantage plan or whatever type of plan. Not saying that it's a bad plan, but it might not be the right plan for you. So here are the 3 questions you should ask yourself when you're new to Medicare or when choosing a Medicare health plan. Number 1, should you get extra coverage? So you're turning 65 or you are retiring and moving off of your employer plan. Do you need extra coverage? When you're on Medicare, you've got A and B. That is the foundation of your coverage. So the first question is, do you need extra coverage? Maybe you are working past 65 and you're going to stay on your employer plan. Then no, you don't. If you are going fully on Medicare A and B, then we definitely recommend some coverage to work with or in place of Medicare, because original Medicare A and B just doesn't cut it for most folks in terms of coverage and out-of-pocket costs. Also, in just having A and B, you don't have any prescription drug coverage, so you can be penalized. It's a pretty big risk in today's healthcare world to only have A and B, and so you have options to get additional coverage. And so some of these things are the words you hear thrown about or people talk about: Medicare Advantage, Medicare Supplement, prescription drug plans. These are all types of plans that you can purchase in addition to or in place of original Medicare A and B. Medicare Advantage plans, often the ones advertised and often pushed by celebrities, they are private insurance plans that are endorsed by Medicare. They replace Medicare A and B. That's why they have the name Medicare Part C, but they must be as good as at least original Medicare A and B. And they often come with some additional benefits, some perks, the things they love to advertise to you about: gym memberships, eyeglass discounts, over-the-counter coupons, or spending cards. Things that go beyond original Medicare that they try to sweeten the deal with. Or you could go with the Medicare Supplement route. These are plans that work in conjunction with A and B. So you keep Medicare A and B, then you enroll in the supplement, which pays after Medicare A and B pay. So together, they provide a nice comprehensive coverage. And then in that case, you'd also need a prescription drug plan, some extra coverage for your medications, typically a low premium plan that will help cover your medications. So question number 1, do I need extra coverage? If you're on Medicare A and B, I think yes. There are a lot of good, inexpensive plans out there, even if you're healthy. So that's what I'm saying. Even if you're healthy and you don't plan on doing much doctoring, you can get some additional coverage that will work with A and B for a very low monthly cost. All right, so that was question number 1. Question number 2, do I want to travel, or do I plan on traveling, or do I didn't know how to phrase this exactly, but I want to talk about networks. That's what's important here. Do you want to spend the winters down south? Do you have family that lives in California or Colorado or New York and you want to spend time in those places? This is really important because different types of Medicare plans have different network limits. So if you are on a Medicare Advantage plan, If you're on the HMO version of that, typically those have very restrictive networks, and you will only receive coverage for routine care in network. Some of them have some emergency care outside of network, but these are important things to know when signing up for an Advantage plan. If it's a PPO Advantage plan, those typically have broader networks but more costs, more out-of-pocket costs, more co-pays, deductibles when you are using them. And so if you travel a lot, then maybe a Medicare supplement is the right choice for you, as it works with Medicare. Medicare is your primary, and Medicare is accepted all over all 50 states. So that might be a better option if you're spending 6 months here, 6 months there, kind of bouncing around. So that's an important question. So if you travel a lot, don't just buy the first ad you see, because you might not even be able to use your regular doctors, let alone if you want to travel. So traveling or not, that's a good point. If you have doctors you want to see, if you have primary care providers, specialists, if you're being doctored for something, then yes, of course, you need to make sure that, now this isn't about traveling, this is about making sure that the care you expect is covered within network. So number 2, I'll just say networks, or do you plan on traveling? That's really important. And number 3, how much do I doctor? Or what are my healthcare needs? If you are 65 and haven't been to a doctor in 5 years now, no health issues, that might direct you to one type of plan. Or if you have regular maintenance for certain, easily managed health issues, but they do require regular office visits or therapies, that could definitely steer you towards another plan. The important thing here is knowing, really this goes a couple ways. Number 1, you need to know what type of doctoring you plan on doing. That is important. Again, do you do physical therapy, or are you getting blood work done quarterly? These type of things are really important to know, so that you are not having a lot of high out-of-pocket costs on the expected costs. The flip side of that is the unexpected costs. And now this is what insurance is all about. It is protecting you from unexpected risks. And so, while if you haven't been to the doctor in 5 years, you don't know what the future holds. And so, this is where working with an advisor like us, we can show you a plan that gives you really good coverage, or good coverage for a lower premium, and kind of find that sweet spot that meets your budget, your healthcare needs, your network needs, all of that. So if you heard words that sounded familiar and you want to learn more, things like Medicare Advantage, Medicare Supplement, prescription drugs, networks, all of that, click around on our other videos to learn more about those things. Otherwise, if you are turning 65, or if you are retiring soon and need help choosing a plan that fits your budget, lifestyle, traveling, wintering plans, whatever, give us a call here. Call me. I'm ready to talk to you. And I'll get you on the plan that'll work here in Wisconsin or down in Texas. Wherever you want to be in your retirement, we'll get a plan that works for you. And I always promise 2 things. Calling us, a licensed advisor, is number 1, entirely free to you, no added costs to work with us, no additional costs on the premiums. Number 2, always less than an hour. So give us a call here. We'll get you all squared away for your Medicare coverage and whatever your future holds. We'll see you next time.